Hey guys, Ashley with Amare. So I'm super excited to do today's video. Why? Because I do a lot of videos on the talking about skin stuff, and I'm like, use the cleanser, blah blah blah, stop using dial. Okay, so here's the cleanser. It's available in our shop. So I use this stuff all the time. The ingredients are on the product page, but there is like literally nothing in here. It's made with aloe and arnica. Now, I have a video on arnica talking about the herb, why it's good for swelling, blah, 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 blah. And aloe, why it's super important. That's also in the arnica video because there's aloe in there. So, back up. So, you had surgery. Your doctor tells you to use dial or Hibiclens. So you use that. And then maybe like 2 weeks in, or like a week in, or like 3 weeks in, you start to notice your skin is flaking like crazy. You're super, super, super itchy. Your incisions, which I talk about in the wound care video that I just did last week, your incisions start to crack. Like this is the incision around it. The skin starts to crack and peel. Your incisions get really thick and chunky, or even worse, the skin around your incision starts to get like eaten away at, and it starts to widen and thicken your incision. Or they're just not closing properly. Maybe you didn't have stitches. Maybe it was just left open and it's not closing properly. It's red, it's angry, it's cracking, it keeps peeling open. Your skin is peeling, your skin is itching, blah, 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 blah. Guys, all of these things are related to Hibiclens and dial. Now, why do they tell you to use this after surgery? So, you need the antibacterial properties. They'll tell you to start using it before surgery. You need the antibacterial properties, you need to be clean, you need to be sterile, right? Okay, so do what your doctor tells you, use that stuff, great. But after your incisions are closed, when they're not wet anymore, dial and Hibiclens is very, very drying. It dries out your skin, it dries out your incisions so that you're clean. That's fine, that's great. But after like a week, after like a week and a half, when your incisions are starting to close, when your incisions aren't leaking anymore, after like day 3 and 4, when you're not, as raw, dial and Hibiclens will continue to make your skin raw. Now, after dial and Hibiclens, or you guys use Dove. Guys, yes, Dove is antibacterial. Dove is not okay for post-surgery. Guys, Dove will make you flake like crazy. Now, this isn't just post-surgery. Now, I have the other part of our business, the holistic clinic. My cellulitis patients, my lymphedema patients, my eczema psoriasis patients, you guys, anybody who's got that flaky, dry, irritated skin that's related to a medical issue, diabetes, things like that, you should not be using dial, Hibiclens, or Dove. That is a no-go. I'm going to scoot this back because I'm really close to you guys. There we go. You shouldn't be using dial or Hibiclens at all. Again, super, super drying, or Dove. Especially if you're not post-surgery, especially if your doctor didn't tell you to. You want to be using something that's going to clean you, disinfect you, and get rid of all of the gross microbes and things like that are hanging out in there to make sure that you're healing properly without destroying the integrity of your skin. Guys, I cannot stress that enough. You have to be taking care of your skin. So we talk about this in the wound care. We talk about this with the arnica post-op cream that we have. This is like the biggest killer for your skin. Number one, your skin is in your garment 24/7. It's not getting proper air. It's not breathing as it should. Number two, you're drying it out and it's causing it to flake. Those flaky skin particles are sitting in your garment 24/7 against your skin, whether it's a compression garment, a lymphedema garment, whatever it is. It's sitting in there with you, trapped, without any air, and you're sweating and there's moisture 24/7. Guys, ew. Ew, ew, gross, ew, no, ew. And dial and Hibiclens are what's making you peel and flake and have that dryness and that irritation. You guys are so swollen. Your skin is so pulled and so stretched from the swelling. It's already thin. Then you're drying it out on top of that. Then you're putting a garment on top of that. We gotta be doing better, guys. So, how do we do better? Our soap. So, this is the recommended Amare Post-Op Soap. It is a foam. So, first of all, dial and Hibiclens, you have to like rub against your skin. Your skin is already sensitive. You have to rub it and rub it over your incisions because it's like a wash, right? It's like a soap. This stuff is a foam. Let's see if you can see this. It's a light, airy foam. Now, I didn't even do a full pump. That was just a little bit. So how do you use this? On all of your incisions, when you go to take a shower, right? On your incision sites themselves, you want to take a little handful like this and pat and coat. You want to use this like a treatment, not like a regular soap where you're just washing it on and washing it off. There's arnica in this, there is aloe in this. This is pH balancing, so it'll help keep your skin highly pH balanced so that it doesn't get any infection or anything like that. It gets rid of all the little microbes and all the little bad guys that are trying to get in there. Again, all of that stuff is listed on the product page, so you can read more about it. But this stuff will clean your incisions, but also coat it with the aloe so that it stops cracking and being dry, and the arnica is going to help your skin with the bruising and swelling and pain and all of that. Let me get rid of that. So this stuff spreads like crazy. Even though it's a foam, it's still like soap. That little bit is like all over my hands. So when I talk about incisions, wherever you're cut, wherever your skin has garment burn, wherever your skin is not okay, that's what you want to be taking that little bit that I just put and packing it on there. You don't want to just be rubbing it on and washing it off. Pack it on there, use it as a treatment, let it soak in and treat the whole area. Same thing for your tummy tuck. Take a little bit, pat, 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 all the way. Same thing for a breast augmentation, pat, pat, pat. Now, fun little fact, steri strips or tape or any of the things that are covering your stitches or your incisions from a breast aug or a tummy tuck. Even sometimes they'll put little steri strips over your regular little lipo incisions. You want to make sure that you are also taking that handful of foam and soaking over the tape. Why? Because one, it's going to help clean the area around the tape. Two, if your tape is starting to lift and it's getting stuck to things like the fabric of your garment or any little pieces of gauze or anything like that, it's going to make sure none of that irritates your incision. It's also going to make sure none of that is trapped bacteria. So this stuff is safe to use over wherever you're taped. Just put a little bit on, pack it on there, and wash it off. We're not rubbing against the tape. We're not doing any of that. This stuff is super, super gentle. So we're packing it onto our incisions, even over the tape, and then you're washing the rest of your body with it like regular soap. Then in warm water, guys, you shouldn't be taking super hot showers. You're going to just rinse it off and pat everything dry. And you're going to use step 2, which is our post-op wound care, and step 3, which is our post-op arnica cream. That is our little trifecta there of healing for when you shower, your at-home care. Now, what happens if you cannot take an actual shower? Sometimes with drains, sometimes with tummy tucks. Doctors won't let you take a shower, sometimes for a week, sometimes for more. So how do you use this stuff? Well, you take a bowl of water, warm water, you take a bunch of the foam, pump it in there, dissolve it in the water, and then take a washcloth. Or, if you do it the other way around, wet the washcloth and pump the foam onto it. And then you're going to just gently pat all over. And then gently wash it off, and that's it. So it's not only just for your incisions and where you were cut, it's to treat the rest of your skin that's in the garment, the rest of your skin from surgery, to keep it from breaking down and becoming very thin and very flaky and compromised, and keep it nice and hydrated and soft so that everything heals properly. Because again, as I talk about in my scar video, the scar is the damaged skin around the incision, not the incision itself. And if it is the incision itself, it should be a very thin line. This is my scar from the wound care video that I did like a week or 2 ago. I've been using the wound care on it. It's a very, very thin line. If you go back and watch my wound care video, it was like a big open slash. Now it's like a very thin line, and that was a week ago. And it's just gonna keep getting better from there. So we want to make sure that we're treating that skin, make sure that we're cleaning it properly, making sure that it's getting all the good stuff it needs, because again, it's trapped in your garment. So we want to make sure not just our incisions, but everything is properly disinfected, that we're not flaking, that we're not having, you know, our garment burn areas. And that's another thing, guys. Garment burn should be treated as a wound. You should be using your wound care on your garment burn and treating it with this stuff, because this is going to help coat your garment burn, clean it out properly, protect it, and then use the wound care on it to help it heal, because it is a wound. So same thing with if you didn't have surgery and you've got cellulitis, or if you've got diabetes and you've got that flaky skin, if you've got lymphedema and you've got that flaky skin, this stuff is going to repair your skin. It's going to help the integrity of your skin, because the swelling is ripping it apart and causing pressure behind it. So this stuff is safe post-op. It's made by a company that makes products for plastic surgery recovery, and there's not all those other chemicals in there. It's not drying. It will help you stay clean. It'll help protect your incisions. It gets rid of all the bad little germs and microbes and bacteria that's hiding in there that could possibly be trapped by your garment and all of that. So again, this has aloe and arnica in it. We love this stuff, I use this stuff every night. This is my bottle every night in the shower. Because I rock climb, like I said in all my other videos. I'm a very active person. So even using this just to regularly shower at night, it definitely helps with the soreness. It definitely calms the skin. And that's the biggest part of what we're battling here, is your skin is being super, super abused from the garment. It's being trapped in there. Even if you're wearing the foams and it's not being abused by the garment, you're wearing the Amare Lipo foams the way that you should, that skin still needs to be hydrated. That skin still needs to be able to breathe. It needs to be treated properly, and it needs to be cleaned properly. And that's what this stuff does. It's not just a soap, it's a treatment for your skin to help everything heal the way it should. So this is first, you go in the shower or you little sponge bath with this everywhere. You use your wound care on everything you can get to on your skin that you need to protect and heal. And then you will use your post-op arnica cream, very, very thin layer, fingertip strength, rub it everywhere and get yourself all treated. Then you get back into your garment and your foams. And those videos will be coming soon. So guys, this is available in our post-op shop. The link is in the bio. If you have questions, if you're like, oh yeah, my skin's kind of a mess, I should probably talk to her, or I don't know what I'm doing, or I want to purchase stuff and I don't know what I'm doing, I'm super overwhelmed, call and set up a virtual. So 732-841-0142. I will talk to you, figure out what you got going on, where your skin's at, where your incisions are at, if you need a garment, if you need foams. The garments are not currently available online yet. Those you have to purchase through a virtual consult with me. I can ship you out a box with all of your products specifically for you, with your garment and your foams and everything that you need, and we'll get you all set up. And that's what our virtual consults are for. So you can schedule those, give us a call, and I hope you guys, I hope this helps. I hope you check out our shop. And like I said, these are now in stock. So if you need help purchasing things, if you need anything like that, set up a virtual, check out our shop. The link is in the bio. The link for this is also in the bio. And I will see you guys very soon. Have a good rest of your day. Bye.